Good afternoon, everyone. This is Dr. Sundari Mase, Health Officer, Sonoma County, to give you an update on coronavirus in Sonoma County. As of today, we are reporting 115 total cases, 84 active cases, and 30 recovered, and we still have one death that we reported on March 18th. Yesterday, we discussed the importance of covering your face with some sort of a facial covering, whether it's a shawl or a scarf or a homemade mask. Today, we're going to talk about contact tracing. Contact tracing is a process by which we find people who've come into close contact with a person who already has COVID-19. So when we diagnose a person that has COVID-19, we perform a case interview and ask that person about all the different contacts that they may have come into close contact with over the past 2 days prior to their onset of symptoms. So this usually includes people in their family. Sometimes it includes people outside of the family if they had been in a workplace environment. And we get all those people's names and contact them to see if they are also sick. Now, contacts to cases need to quarantine for 14 days. And during that time, we have someone call them regularly to see what their temperatures are. They should be checking their temperatures twice a day during that 14-day quarantine period, and also checking to see if they have any other symptoms that we would associate with COVID-19. That way, if one of the contacts also becomes ill with symptoms, they can be tested right away to ensure that they have not also developed COVID-19. Of course, once someone is diagnosed with COVID-19, they are placed in isolation away from others so that they don't infect anybody else, and so we limit community transmission. This intense form of tracing contacts helps keep COVID-19 out of the community. So this helps protect everybody in the process, and hopefully will decrease the number of cases that we see over time and help us flatten the curve. Now, every day, we also take a question from the audience. Today's question is, when will Sonoma County have more widespread testing for both the virus and the antibodies? This is an excellent question. As you know, we're really ramping up testing, and as of today, we've performed 2,580 tests here in the county. We still are asking people to abide by the shelter-in-place order and to ensure that if they are ill, they stay at home, and if they have symptoms, that they should call their physician and be evaluated. They can leave the house for any essential activities such as seeing the doctor, going to the grocery store, the pharmacy, etc. Now, in terms of testing, we have plenty of test ability in the laboratory. In fact, we have several labs now that are testing for COVID-19. There's our own Sonoma County Public Health Lab that's performing up to 120 tests per day. And there's also Kaiser Lab, the Sutter Lab, and we have our commercial laboratories like Quest that are also performing tests. We have, however, as most people know, had a shortage of the swabs and test kits for collecting the specimens. That is a nationwide shortage and a statewide shortage, and we're working on trying to get more and more of these test kits so that we can actually test everyone who needs testing. That will be our goal moving forward. So thank you very much. Stay safe, stay at home, sheltering in place whenever you can. Only leave your home for any kind of essential activities or to participate in essential travel or essential business. And we'll talk to you again tomorrow. Thank you.